We are today in our clever dental offices. We have this all over the country and do our best to serve our communities. Do your stuff. So whatever you think is needed.
Welcome to Clever Dental here in Denver, Colorado. My name is Victoria Ton. I'm a new dental associate here at Clever Dental, and welcome to the office. We have 6 operatories. Here we do mainly all our x-rays, treatment planning. And here we do all our treatment, hygiene. Here is where we sterilize instruments. Here's Miss Donna. We do CAD/CAM technology here, so we get to design crowns from anywhere, like how tall it is, what it looks like. That's how we're able to produce it like within a day's notice. So we just take an impression here, and then we just put it into the scanner. We're able to design on how it looks, with the material, and then we could just send it to lab and mill it ourselves. We design it on that computer, and then we take it here, and this is actually where it mills. So we can get a crown milled within 24 hours and then get the crown back to the patient as soon as possible because it's all done in-house.
Stanford dropped 11 varsity sports, which I played field hockey there.
Because of money.
Because of money. But they're gonna.
Remember what I told you?
Everyone else is gonna do it.
Remember what I told
know.
you? This is one of the appliances we use to try as much as possible to prevent infection with COVID, obviously. So this is a special ventilator which ionizes the air, and this way kind of purifies from dust and also from bacteria, viruses, hopefully. We have 2 of those which kind of circularly ventilate the air. You know, dentistry was also shut down to understand, and still not fully understood actually how the risks are, but obviously we have to adapt, and we did indeed several things where I tried to minimize the risk. Okay. Very good. I remembered that many years ago, 1997, I produced a CD, Far Away, Alexander Chekhov. This is actually my teacher, and so he asked me whether I can help him to get a production of his recordings. And so I kind of benefited him in just kind of granting. Unfortunately, he's not among us anymore. And but beautiful piece. Guitar, he was a guitar player, classic guitar player, and actually he's a wonderful piece which I love. I play myself. And actually this picture, I still have original. It's my picture. I was kind of drawing it, you know, this is modern art.
Oh, okay.
Ladies and gentlemen, Dana!
Hello, Dr. T. I just was wondering,
Today's full.
what does implant consult like indicate?
Implant consult, usually I think right now we have a special, we don't charge for this, but we have to find out. In any case, implant consult is always a panel.
Yes.
And then based on this, we may actually choose to do additional imaging, so we can get somewhat a qualified opinion of what is possible. And it is usually at no charge.
Yes,
okay?
sounds good.
Very good. Eddie, what we do again here?
Remove implant 30 and the bridge and extraction.
I see, and the bridge and extraction. Okay. Do you have a panel print out? Yeah, very good. So, Eva, how we do? We are flying to the Mars now. Oh, I need my glasses. Are you aware what's going on here?
Kind of.
You need to sign consent form if you want to be as a star.
Bills, bills, and bills. Got to pay the bills. I've seriously been trying to scan in the same 3 pieces of paper since like 8 o'clock this morning. The doctor basically had this idea on how to keep the office running during COVID. And great idea, let's do it, let's move forward with it. So we put out ads, we need a dentist, we need hygienists, we need, everybody. Dental assistants, front desk, and it's amazing to see, because of COVID, how many people actually are looking for a job.
I tell you, obviously we had some problems, especially with employees. After the COVID hit us, we had some areas where we lost functionality in terms of staffing, and then to regain the appropriate staff was not easy. We had several staff members who came in and were basically afraid. I thought you play basketball, but he told me no, you do.
TBR, man.
What is DDR?
Dance dancer.
Oh, yes. Now, yes, Mark, we have an assistant. Her son is top in, how you call this, breakdance.
Breakdancing.
And you cannot believe this. It's not just him, he's kind of champion and so. He made a business, and he has, I think, several dozen people who dance for him, and they go from hospital to hospital and do like therapy for children. I don't know, I never heard that, but it's very successful. Yes, it's very interesting.
Just a lot of dynamics have changed things. So the interesting thing is, in this hiring process, is the amount of people we're actually receiving, looking for jobs, looking for hours, looking for a busy office to work, So it's kind of been very interesting how COVID has changed the job market dynamic as well.
You okay? You okay? Blood pressure is good? Yeah, we ordered in each room with the COVID, because of the aerosol, and obviously we are not equipped here, we are not in a hospital. So the idea was, how can we even more reduce the chance of infection? So this is basically a standard dust evacuator, but it has a HEPA filter in it, which can easily be washed and back. And so that's what we do here now. Just hold this. Yeah, you're good. Open. We do see here patients to help them due to pain or other problems they have with our teeth, and obviously the teeth is an important part of our bodies. Hold it down. Beautiful. No, yes, so we did adapted obviously some procedures, especially which are connected with instruments which create aerosol. The dental office is a location where we treat patients who need our help.
Sure, no problem. What are you coming in for? No problem, we can definitely help you with that. Let's see. Dr. Tversky, because of the virus, our hours have kind of changed. So he's here on Mondays, Tuesdays, and Thursdays in the morning. And then he's also here on Wednesdays and Fridays in the evening. Do you have a day that works best for you at this point? All right, perfect. We have you scheduled for Thursday at 11:30 on the 16th. Have a great day.